Hello and welcome to Breast Cancer Now's Facebook Live. And I'd like to welcome you all to this session we're going to be talking about a subject that's a very common problem for particularly women who have been through or are going through breast cancer treatment. And it's vaginal dryness, or known as vaginal atrophy. It's something that is quite a taboo subject in many ways. Women feel very embarrassed about talking about it, and feel they can't approach their treatment team or GP in many instances. So, as a charity, we're trying to address that, and with our support and services. And to sort of help us with that, I'm delighted to be joined by Jenny Constable, who's a physiotherapist, who's got a wealth of experience in women's and men's health. And Jenny's going to be talking about some of the ways that hopefully, it can be managed, and hopefully that will be really helpful to everyone. Just a reminder that you can put in any questions that you wish into the chat box. If you've got any questions for Jenny during the talk that she gives, that's absolutely fine, and I'll put those questions to Jenny. If you feel that you can't ask them in the open, we have a confidential helpline, and you're really welcome to leave a message on our voicemail. It's 0808 800 6000. I'll give that number at the end, and it'll also be on the links as well, and on the web pages also. You can, and that we are open 9 till 4, Monday to Friday, and then we also open on Saturdays 9 till 1. It's a confidential service, and you'll be able to speak to one of our nurses. So if that's what you prefer, or you can write to us, nurse@breastcancernow.org. I think that's all the housekeeping, but so welcome, Jenny, and thank you so much for agreeing to do this talk for us, and coming to join us on your this cold November evening. So without further ado, if you would like to tell us all about yourself, and give us a chat about vaginal atrophy.
Yeah. Well, thank you so much for having me. I love talking about anything to help women in any part of their life, and obviously going through breast cancer is probably one of the hardest things to go through. So anything to make women's life better, I'm really happy to do. So yes, as Addie said, I'm a women's health physio. I've been a physio for 16 years now, and specialising in women's health for the past 14, and I love it. I love my job. Just love being able to give women time to talk and be listened to, and know that there is help out there, and that no one needs to keep things to themselves, and they should be talking about it. And I think women are talking a lot more about it now, with obviously social media and obviously lovely things like this today, and hopefully we'll get some questions as well that women want answered. So yes, I think in terms of the women that I see a lot of women going through or after breast cancer who one of their main issues is vaginal dryness, amongst other things. So I'd say the key things are the vaginal dryness, itchiness, discomfort around the vulva, which then obviously leads to painful sex. They can then get recurrent urine infections, and that kind of discomfort around the area in terms of the lack of vaginal lubrication. And a lot of that is due to low estrogen. So obviously women who are post-breast cancer or going through their treatment, they are on medications, as you know, that either strip them of estrogen, or they've had a gone through early surgical menopause because of other forms of cancer that have meant that their estrogen is plummeting. And we have we have estrogen receptors all over our body, and particularly it's used to make everything a little bit more lubricated, more blood flow, vascular. So when we have low estrogen, particularly around our vagina and vulva, the skin around there starts to get a little bit thinner, less blood flow, and it gets a little bit drier. And that can then cause a bit of irritation. It's as simple as like, when the winter changes and we get sore lips,
Absolutely.
you're straight for the lip balm, and we forget that our vulva is just skin, just like our face, and we put moisturizer on it every day, but we forget about our vulvas and how important it is to moisturize them. And actually, simple thing as moisturizing them can make a big difference. And with that, I suppose one thing that I would get a lot of women to do is using vaginal moisturizer lubricant. One particular one is there are loads of different ones out there, but the kind of, although it's going to be backwards, the Yes oil-based lube. They've changed their branding now. It's now green, but I often get women to just use that as a moisturizer, so outside their labia, and they can also put a little bit inside, there are certain syringes that they can pop the lubricant in and then actually pop it inside the vagina to give it a little bit of lubrication. And that can be done daily or every other day, but obviously remembering what goes in does come out. So if they put a little bit too much in, they'll end up being a little bit uncomfortable. So you'll go to the extreme of having a little bit uncomfortable in your underwear. But that's definitely one thing. One simple thing that women can do is pop that little bit of moisturizer on, lubricant. There's coconut oil. Yes, do a coconut-based one as well, or they do a water-based one. That any are good for comfort. Yeah. Another problem that occurs with that lack of estrogen is that the urethra, if you think of the urethra like a straw, and it's full of grapes, so it's nice and plump and sticky, and then when we lose that bit of estrogen, they become a little bit like raisins and they don't stick together. So your urethra, even though you might have a strong pelvic floor, which we'll go through in a second, you might still find you're leaking urine because that urethra just doesn't squidge shut.
Yeah.
Because of that lack of estrogen and because that area is a little bit drier. So even vaginal moisturizers can help with that.
Yeah.
Or even some women, again, this is all individual, but I think even with the sort of nice guidelines that women can, even undergoing breast cancer, can have vaginal estrogen topically, I think, which is something that everyone's a bit frightened about asking for, or that they can have. But I think you'll agree with me, Addie, that it is deemed unlikely to cause an increased risk of anything, in that the amount that goes into the bloodstream is negligible, it's tiny.
So that's the newest guidelines that actually only came out, the National Institute for Clinical Excellence guidelines on the management of menopausal symptoms, isn't it? That came out on the 7th of November, and says that, in obviously a case-by-case basis, absolutely they will consider vaginal estrogen, because as we know that women that have had a breast cancer diagnosis are, whether it's an estrogen receptor positive or a triple negative breast cancer, they're advised to come off any HRT and not to go on to hormone replacement therapy. So this is actually might be a game changer for some women. What I would say, obviously, with caveat that it's really important for everybody to go and to their treatment team or their GP to inquire about it, because it's not for everybody, and some women won't be eligible to have vaginal estrogen, unfortunately. But yes, I mean it may well be a game changer, which would be fantastic for some women. Yeah.
And with that, there's loads of different brands and strengths of it. So there are quite some low ones that often it's like a little pessary, a little tablet that you put inside the vagina, sort of twice a week. Or some of them are actually creams that just go around the outside, which some women might tolerate more from an itchiness or discomfort, rather than it being an internal feeling.
And of course, I was just going to say, when you were talking about the itchiness, and it's really important to rule out, if you've got that sort of dryness and itchiness and soreness, go to your GP and rule out any infection or
Yeah.
fungal infection or urinary tract infection, isn't it? Before
Yes.
you sort of embark on anything else, because it may
Yes.
be that it's a simple solution, but obviously if that's ruled out, then to go on to these other things.
Yes, definitely.
Yeah, I do have a question. Is that all right? Is that before you go on to talk about the anatomy
Yeah.
part? Um, uh, so Kazia says, I think it's connected with today's topic. Started having a problem with using intimate gels to wash with. I never had a problem, but now I bought a third one to try and can't use it, as causing such discomfort and irritation when showering. And I don't know if she's talking about something that's perfume, but
So,
what
well,
would you
so
say to that?
first thing is the vagina
Yeah,
is self-cleaning. So even though there
yeah,
are lots of products out there that are deemed safe, um, really we just need water,
yeah.
and water rather than anything soap or perfumed. The vagina is really acidic. So if you remember back to school days where you're talking about your litmus paper, the vagina is 3.4, which I think
Very acidic.
stomach's like 2.
Yeah,
So you then water itself is quite alkaline, neutral,
yeah.
and then soap, even though they potentially add sort of citric acid to it to make it acidic, it will never be 3.4.
No.
And of course, you change that pH in the vagina, you then are more likely to grow fungal infections or bacterial infections, because they the acidic environment stops them growing. So I would suggest go back to water to begin with. Start with that. Get a level sort of feel of everything's not sore and itchy, and then either even trying the sort of water-based lubricants or something after you've been in the bath. Shower, just to see if that kind of helps with any discomfort. But yeah, definitely first I would try and avoid anything perfumed or soap, purely because the vulva is so sensitive to pH changes.
Yes, and I was going to ask actually. I was going to say there is a difference, isn't there, between lubricants and moisturizers? Can you explain a little bit about that? So
I think it's
lubricants
I
tend to be
suppose
short
lubricants a
acting.
lot are used for sex and penetration.
Yeah,
Um, and then moisturisers are a kind of quite a new thing that they've sort of labelled as a daily or every other day application. And I would say, in theory, I would say you could use both,
yeah,
either or, because
yeah.
sometimes you might prefer the oil base of a
Probably
lubricant rather
comfort.
than whereas the vaginal moisturisers tend to be a little bit more water based,
Yeah,
and water based will always get reabsorbed and get a little bit sticky,
yeah,
whereas anything oil based or silicone will last a little bit longer.
and
So
perhaps
yes, there
feels
are,
a bit more like the vaginal, sort of the
yeah,
texture
secretions, yeah.
within the vagina.
Yeah,
Yeah,
so yeah, and again, it's everyone's sort of preference in
yeah,
terms of what they feel comfortable with.
yeah,
But I would say, you know, it is sometimes it's a little bit of a marketing trick, I think.
yeah,
But yeah, they can use either, but and it's just deciding which textures they like, what lasts longer, and a lot of companies will do sort of either free sachets or they'll do sachets, so you can always try
try
them
it. Yeah,
and see what feels
it's a good
comfortable.
idea.
And
Yeah,
again, obviously, any discomfort, irritation, stop using it.
yeah.
Speak to your GP if anything lasts in terms of irritation, itchy, redness, change in smell, or anything like that.
And I just wanted to, as a caveat, if your partner is using condoms, don't use an oil-based lubricant because it will destroy the rubber on the condom. So just
Yeah.
as a yes aside. But I have a few other questions, but would you like to carry on about?
Should I go? Should I
So
go through a bit about pelvic floor and kind
yeah,
of pelvic floor exercise in terms of uh, those that may have a little bit of incontinence because of that lack of
yeah,
estrogen or discomfort, or just understanding pelvic anatomy. Um,
brilliant.
I bring my trusty model
Yes,
with me.
I like your
So
model.
sorry for the graphic nature. So yeah, this is a pelvis. We've got the pelvis bones either side, and then you've got the bone at the front, which is at the front of our pelvis, sort of where your zip is on your jeans. And if I spin it around your spine would kind of come down here into what your sacrum is at the bottom, and then your tailbone. And if I turn it upside down to see the nitty gritty, all this red area is pelvic floor. So they're just like muscles like our arms and legs. They start from our tailbone and they go forward, they wrap around your bottom, forward around the vagina, and then around the urethra, which is in here, and then they attach onto your clitoris and the pubic bone at the front. So that massive amount of area that they cover. And obviously then we've got your skin on top, and all that area is then going to be impacted by that lack of estrogen, because muscles rely on estrogen as well for blood supply and being plump and kind of strength training. So it might be that area gets a little bit weaker again with, fatigue from treatment, chemotherapy and things like that. It's going to really impact all our body functions. Yeah. So in terms of the pelvic floor, how we squeeze it, we want to start from our bottom, kind of closing around the back passage, pulling forward and up towards the vagina. So I kind of always start with sort of thinking about breathing, and I think breathing's so key with pelvic floor. Yeah. So I'd say pop a hand on your chest just below your bra strap, if you're wearing one, and one hand on your chest, upper chest, and just feel what happens when you're breathing. And in theory, at rest, we should be breathing from our tummy, from our diaphragm. So as you breathe in, your tummy lifts up, and as you breathe out, it should fall down. And I think breathing can really regulate stress and worry, particularly.
Absolutely, yeah.
That's linked with everything that you might be going through. And again, if you're itchy, dry, uncomfortable, a little bit, sometimes that raises our stress and we get
anxiety,
uncomfortable, and that can make our symptoms a little bit worse. So yeah, just thinking about breathing, relaxing, and then what should happen is then as you breathe out, so as that you're breathing in, your tummy lifts up. As you breathe out, we're trying to squeeze up around that back passage, closing around the bottom as if you're stopping passing wind. Keep closing the vagina, and then all the way up to the front as if you're stopping having a wee, and then you let go, and you kind of want to feel it drop back down again as if it's a bit like a jellyfish, so it's kind of lifting up, pulling up, and then dropping back down again. Yeah. And in terms of kind of exercises, you want to do quick ones, so that's that kind of lift and up, and then you let go. And exactly the same way with all of them. It's that take a breath in first. Yeah. As you breathe out, we're squeezing, lifting up, and then letting go. And then we repeat that again. And we want to try and do 10 in a row, at least twice to 3 times a day. But also those ones are quite good to be able to do quickly, so that if you do sneeze or cough and you are having a little bit of leaking, you can try and squeeze before you sneeze. It's the sort of the motto, squeeze before you sneeze. And then you also wanted to kind of do lifts and holds. So it's exactly the same way. As you breathe out, we're lifting up, squeezing around that back passage as if you're lifting something off a chair, holding, and you want to try and keep it there, but try to keep breathing just normally, not necessarily those big breaths in and out. Yeah. And then letting go. And the goal is to get to kind of 10 seconds or roughly 3 to 5 breaths in and out. Yeah. And then letting go and actually going, oh, did something let go? It did let go. And then repeating that up to 10 times, what you can do. And it's just kind of knowing you stop when you start to feel, oh, I can't hold it anymore. And I think even just having a look, having aware of that pelvic floor can really make a big difference for women. So, we often don't look at ourselves. And I would definitely love women to look and check their skin. It's skin just like everywhere else. We should check for any imperfections and moles, things like that. So having a look, and you can actually see your pelvic floor working. So when you squeeze that pelvic floor, your bottom and your perineum should sort of pull inwards towards your body. Mm-hmm. So kind of a little bit of a sort of puckering. And then when you let go, it should sort of unravel at you. So sometimes seeing that can give you the confidence that you're doing the right thing. Yeah. Also, if you're not seeing it and you're struggling, that's that kind of cue to go, okay, maybe I need to go and see my GP and get a referral to physio, or can I find a physio, pelvic health physio? And we can always put links up where there's lists of physios in your area that can help you. Yeah. In that sometimes just having someone tell you you're doing the right thing is really important. Yeah. It's not as simple as a arm exercise. But also having a look at that skin when you're there, and noting what your labia look like, because that sort of dryness or the kind of irritation can sometimes make the labia start to get a little bit smaller.
Yeah.
And it's noting that then think, okay, maybe I need to go and chat to my GP and think that I'm not a bad, it's not bad that I'm noticing that I've looked at myself. It's good, and
Yeah.
that, that they want to know that you're looking after yourself and going to potentially ask for help, be it
Yeah.
can they take vaginal estrogen, or is it just that they need to put some lubricant on or moisturizers to help that area?
Yeah. And I think culturally, for some women, I think having a referral to somebody like yourself would be such it would be brilliant, because it would take that embarrassment away, knowing that with a professional, and maybe it's less embarrassing for them, particularly if they're not, well, not many of us are used
No,
to looking
I'd
at
say
each other,
I'd say
ourselves, are we,
100%. I'd
So,
say for all the women I've seen, very few go, yes, I did look at myself before
yeah,
I had a baby, or before, most of them are like,
yeah,
oh, does it look different? I don't know. And so we really should look at ourselves more often.
yeah,
If you do get the opportunity to see a women's health physio, we're all generally very relaxed, and this is what we do for a living. We
yeah,
it's like looking at a foot for
yes,
us.
yeah.
It's really, and we just want to help.
Yeah, no, that's brilliant. I do have another. Oh, yes. So Johanna was asking. I had a smear test which was really painful due to vaginal dryness. Have you any suggestions? But I guess again, it's about that pelvic floor, and or using some sort of lubricant before you
Yeah.
go for your smear, isn't it?
Yes. I guess I don't know if that also potentially links. So I think a lot of people find smears uncomfortable,
Yeah,
but if it goes with sort of also sex, and anything going in is painful.
yeah,
First thing, I'd go back to that breathing. So
yeah,
when we breathe in from our tummy, the idea is that the pelvic floor lets go and relaxes. Because when we're worried, stressed, and anxious, or about to potentially have something that's painful, our pelvic floor acts like our bodyguard. It will tighten. We might not know that it's doing that, but it will actually squeeze and tighten. And if you then imagine a circle of muscle around here squeezing, trying to then get a speculum in or anything else is really painful. And often that pain is not necessarily because things are ripping or tearing. It's often because the nerves around there are just saying, oh, I'm not sure
yeah,
about this, but if I
yeah,
give you pain, you'll make it stop. And often then we get a bit of a bad cycle.
yeah,
Um, so the first thing is breathing. It's that kind of, right, can I just lie there, breathe into my tummy, and kind of imagine I often tell women to imagine they're trying to pass wind at the same time, which they might not want to feel like they're doing on
no,
a smear test. But
no,
the idea of sort of breathing in, let that belly rise up so that you're really kind of relaxing that diaphragm, and trying to then cue your pelvic floor to let go. The next thing would be, yes, potentially taking lubricant, although I'm not quite sure whether it might impact some of the smear results. So it would be
normal lubricants
it's
don't.
fine. So just like kind of
Yeah,
that.
water-based lubricants. They often use them,
Yeah.
but yeah,
So you could do that. And then the other thing is, if things are really sore, and you could always just double check with the nurse, is that, or checking with your GP, that you can get a sort of 5% lidocaine cream, which is a numbing gel, a bit like, if you ever use Bonjela for ulcers. It's just an ointment that some pharmacies you can actually get over the counter, or you can ask your
okay,
GP, but you could just apply a sort of thumbnail amount around that opening where it
yeah,
might feel a little bit uncomfortable, and it lasts about 4 hours, to give a little bit of relief, and it can often sting a little bit to begin with, and it
yeah,
should sting for about 10 minutes maximum, and then it
okay,
should go, and then it would be numb, and I would say if it was really uncomfortable, trying that, or the other route is going down things like dilators,
uh-huh,
which are, I don't have exactly one with me, but
right,
this is a pelvic floor wand, which is a bit like a massager for
okay,
any muscles, and we use this a lot to kind of actually go into the vagina and ease out and relax those muscles that are a little bit tense.
Okay.
And I mean, I would always say try and talk to a physio before you potentially go and get something like this, just to give you that bit of advice. But there are things that can help ease that muscle.
Okay.
Just like
Yeah.
we press our muscles up in our shoulders, they're tense.
Yeah.
We get the same around our vagina. So relaxing and easing into those muscles can really help.
Yeah.
And doing a bit of prep work prior to a smear might be really helpful. So a lot of
Yeah.
women could just try a finger inside with some lubricant,
Uh-huh.
and you're just sort of sweeping, or often your thumb, but it's always a bit awkward, but your thumb just kind of between that sort of 3 and 9 o'clock position with a little bit of firm pressure to see if that can just ease and relax any of that tension, to then hopefully help you with them put a speculum in. The other tricks are potentially asking for a small speculum, or even a
Yes.
pediatric speculum.
Yeah. Yeah.
And often you can try and put them in yourself, and then the nurse can do this, or the doctor do the smear. So it might be that you're a little bit more comfortable to put in the speculum,
Yeah.
and then they can open it up.
Yeah.
Um,
That's really helpful. Really
yeah.
helpful. Yeah. No, it's good. Um, oh, we have another question, but I'm not sure if we can particularly answer it. So Tracy asks, how long should you be using pessaries for? Is there a specific time frame? And I guess it very much depends on the person, doesn't it? And what they've got it for,
Yes.
really.
You mean
Yeah.
the vaginal pessaries, and
Yes, yes, I
like
think
the
that's
estrogen? I
she's
think
asking. Yeah.
so. Um, in the sense of normally you use them every day or every other day for a month. You sort of build up, almost you're building up that plumpness in your vulva,
Yeah.
and then you tail off, so you're using them once or twice a week. And I'd almost say that's, if they can, I would say that's a continual use,
Yeah.
unless their oncologist or team have given them a set time. But I was always under the impression from a gynecologist, oncologist, that the sort of the plumper and the readier the tissue with estrogen, the amount you absorb going forward is less. So you almost
Yeah.
absorb more while it's dry, and then
Right.
once it's at a good level, you then only need that little bit just to keep it topped up.
Okay.
And I'd say most women are then just taking it continually until as long as they feel comfortable.
So,
And it's something that you could come off it and go back on it again if you wanted a break.
yes.
But obviously, every time you come off it, and if your symptoms return, that labia and that tissue might then get thinner again. So it's sort of,
Yeah.
I'd say most women probably continually take it if they're allowed to.
Okay. Yes. And again, I'm sure Tracy's doing this, but obviously you need to go to your GP,
Yeah,
back to your GP, and just clarify
just double
that,
check.
because they're the ones that prescribe it. So, and we've also had a question. Actually, we had a question earlier from Janice, and again, I might be able to shed some light on this question, but it's why can't they adjust the dose of letrozole, for example? So the hormone therapies, surely this could help with side effects of vaginal dryness. Well, different hormone therapies work for different people, and actually the dose of letrozole is sort of set. So if you are on that dose, that's the optimum dose for you. I mean, sometimes what women do if they've got severe side effects is they will ask their treatment team maybe to either change to another aromatase inhibitor or another hormone therapy to see if that helps, because what gives them side effects for one drug might not give them side effects for another. Or take what they call a holiday, so a break from it to see if that is what's causing the side effects. And of course, it's, as Jenny was saying, they're side effects of menopause because they're induced by the hormone therapies. So it may be that it helps, maybe not, but the dose is set. So reducing the dose wouldn't give you an optimum treatment. So I think it's about going back to your treatment team and seeing if there's anything they can do to either change that hormone therapy if it's giving you those side effects, or to have a break from it and have that conversation with them. Yeah. So I think that hopefully that answers Janice's question. I just have a question from Joanne asks, is Balance Active ACTIV imitate daily wash okay to use, please? But I mean, I don't know if that's a product. I don't know if are you
Yes,
familiar with that?
I am. So it's often used for BV, bacterial
Oh, bacteria.
vaginosis
Yep.
treatment.
Okay.
And so yeah, some women use it as a short course treatment, like they'll use it for 2 weeks,
Okay.
just to help with symptoms. Or sometimes if women are sexually active, they often then get a bit of a flare up after sex, in that if they're not using condoms or even lubricants, that can change the pH. And the BV active, or there are other things like boric acid that just you can get suppositories of boric acid, which it sounds horrific, but
Yes.
you actually it can help lower the pH and actually make that environment around the vulva better. So
Okay.
yeah,
Right.
I have had women use that BV active wash,
Okay.
to which and has been effective.
I mean, can they buy it over the counter? Did you say they
Yes.
can buy it over the
Yeah.
counter?
It's on online. You can get
I
it.
I
Yeah.
just wonder whether maybe again they just before they you use anything that's over the counter or prescribed even, that's alongside any medication you're taking because of your breast cancer. It's really really important that you check with your treatment team, or GP, but probably treatment team if you're on something like a hormone therapy tablet. But yeah, so before you try anything like that, because it might cause more damage you know than the use of it. So yeah, but that sounds okay. I wasn't familiar with that. I used to work in sexual health, but it was many moons ago. So yeah. um,
There are all sorts of things out there, but yeah, there are.
yeah.
They're generally um, readily available, and yeah, you just double check with your team. But they can be. I think I would probably go for that more than some of the other feminine sort of wash
Okay.
products.
Okay. That's very interesting. Um, is there anything else that you would advise to patients that come to you with anxiety about um, you know, relationships, or is it, the pelvic floor, exercises obviously help.
Yeah,
Um, would you
I think.
recommend things like yoga and Pilates
Yeah,
and things that use your pelvic floor
yes,
very
definitely.
much so,
So,
if they can do it?
100%. So one thing is resistance training is good for our bodies. So if we go back to the dreaded drop in estrogen,
Yeah.
so that kind of menopausal type picture, women are prone to tendinopathies all over our bodies, which is where you might get joint pains in your shoulder and your knees. And we
Yeah.
know that resistance training, so strength, bit of weight training, is very good,
Yeah.
not only for our tendons but for our bones, which can help prevent something called osteoporosis, which is when the
Yeah.
bones get a little bit softer. So 100%, as long as you are allowed to exercise, you've
Yeah.
talked to your team and you're safe, or you have a specialist physio that you're seeing, then that guides you. That's really helpful. So that's kind of along the lines of Pilates. Yoga is great for relaxation, calming, just kind of getting to know your body and really breathing and knowing where your body is in space. I think that kind of being able to zen yourself and go, okay, this is where I am. I'm, a little bit uncomfortable at the moment, but can I bring myself back by doing some breathing, by doing some stretching?
Yeah.
So yeah, 100% yoga, that's really helpful from that
Yeah.
side of things, just to kind of move. If you've had any sort of mastectomies and treatment, obviously we want that kind of movement, that range in your upper body and your
Yeah.
chest. So undertaking any sort of yoga that can help with that sort of range in your upper body. And then it's just, making sure you're talking to your partners if you're uncomfortable, if you are sexually active and it's uncomfortable and it's painful, it doesn't have to be, and it doesn't mean that it will be going forward.
No.
There's 100% there's stuff that as physios we can help with, that you can help yourselves with, even just by looking at yourself and going, okay, I can see that that skin looks a little bit dry. We'll pop a little bit of lubricant or moisturizer on and then see if that makes a difference. And it's not just one, like you lubricate before sex. It might be that you actually like lubricate during. So if you change positions, you have a bit there and you put a bit more on. You can't overdo lubricant. I'm all for putting lots on, and that's why I definitely recommend getting lubricant syringes, so they've got sort of a round tip and you can pop that all the way up inside, and that can just then make that tissue really comfortable.
Yeah. I mean, it's also not putting pressure on yourselves, isn't it?
Yes.
So
Yeah.
maybe, actual intercourse is not
Yeah.
the answer, especially
Definitely.
immediately. Like you were
Yes.
saying about looking at yourself and getting familiar with you and
Yeah.
how you're feeling, and communication, as you say, is key.
Yeah.
And just having that, starting really gently,
Yeah.
with something, that just touching, or even just lying next to each other and just talking and cuddling first,
Yeah.
and not, not putting pressure. I think it's about you both understanding where you're both coming from, which can be really hard, can't it, to do?
Definitely. I think anybody, the best intimacy is talking and being able to say what you want, what you don't like, what is uncomfortable, what would they like, what do you want. And I think that being able to say that is, I don't think men or women do that very well. So I think if you can start those conversations, it's a a definite win.
Yeah.
And just like you said, just being together, not on our phones, and lying
Exactly.
there enjoying
Quiet.
massages,
Yeah. Yeah.
massages, external touch,
Yes.
learning what might be different now, like what do I like now,
Exactly.
do I like that now, do I not like that, it's fingers, it's mouths, it's things like that. It's trying, experimenting with different things that
Yeah.
might give you new pleasures, or even just understanding each other's body and how things
Yeah.
do change. It changes as we get older anyway, let alone when things are sort of pushed upon you too soon.
Yeah.
That's
Yeah.
probably the most upsetting thing, is when you're young and you're having this big change that no one else is going through
Yeah.
yet.
Yeah.
And just having someone understand that, and by talking to them and saying, this is what's happening, my skin is a little bit drier because of this, and I'm going to be doing this to help it because I want to, and then working together. Is good.
Yes, and I mean, I think because a lot of it's anxiety, that sort of you're anticipating that it's going to be uncomfortable. We also sort of say to a lot of people who call us on the helpline, what CBT, cognitive behavioral therapy, talking therapies, counselling, even can really help with that. Trying to remove or making sense of that anxiety and that thing, like you say, it's a new normal for a lot of women. That's what a lot of them talk about, isn't it? And especially, and that's going to be the same with relationships. So, but it might just help you relax and help that sort of line of communication as well. So, no, thank you so much, Jenny. That was just really a really comprehensive sort of explanation, and I think you've given some really good tips on what to think about and strategies to help. And like I say, it's really it's really good to talk, and like I say, I can't emphasize enough how important it is for you to be able to phone us if there's anything you need to talk to us in a confidential space. That's what we're there for. Like I say, you can email us, nurse@breastcancernow.org. But and also if you wouldn't mind completing the survey, we like to see how we can improve this service, the Facebook Lives that we do. But in the meantime, Jenny, thank you so much for joining us, and it's really good of you to spend your time coming to talk to us, and Thank you everybody else for watching
attending.
as
No,
well.
thank you very much. And if I just said they can have a look at the I don't. We can always put it on a note.
Yeah.
The POGP is a physio obstetric and gynae platform that will have a list of physios. They can search for physios in their area that are specialist women's health ones that can be able to help them, which they can then contact and chat before maybe booking if they want to. But otherwise, obviously, you've got your GP.
Yeah.
But yes, but otherwise, yes. Thank you so much for letting me talk today, and hopefully some snippets of information have gone in and helped someone.
Absolutely. I'm sure it will have helped many. And yes, so thank you, Jenny. And yes, we'll definitely put that link up. We'll also put the sort of guidance as well from the nice guidance that's just been changed, updated. And also we have a wealth of information about breast cancer treatments and side effects of vaginal dryness in our health information. So that's on our website, breastcancernow.org. So have a good rest of your evening, and thank you for joining us. Thank you, everyone.